Hello, today is my thesis defense day, and I'm defending on Zoom. Let's go. Here we go. This is my setup. I want to say thank you everybody that joined in today. I really appreciate it. Just so shows how much love and support that I have here in the community, from my mentors, my friends, my family members. I think there's family members tuning in from Sudan as well. So although these are unprecedented times, I think this would never have happened in bringing so many people together today. So thank you everyone that's here. And I'm going to share my screen. Barrett. My major is in public service and public policy with a concentration in health policy. And my thesis for my undergraduate career is quality improvement survey on the barriers and facilitators in ASU ECHO. And my director for this is Dr. Martin, who I appreciate and respect so much, and so as well as Dr. Manson. They're both here with us today. So a little bit of background, what kind of drove me to ECHO is its healthcare model. And I heard about this in my junior year and through attending actually Aziza's master's defense, and I got to see the other ECHO master's students present, and I was just inspired by the work and wanted to jump on. So first I'll share about what is ECHO. I know I'm using the acronym, and the importance of behavioral health integration, as well as the study design for this project and the results and recommendations. So ECHO originated in New Mexico in 2003 to provide specialized care in rural and underserved populations. The founder, Dr. Sanjeev Arora, said something that inspires me today, and he said that curable diseases, patients should not be dying with curable diseases, and just because the providers do not have the specialized care. And I thought that was profound, and his work is so inspiring to me because this ECHO model since then has become in 43 different areas and locations all over the world. What ECHO does, it is a knowledge sharing hub for providers. Providers are participants in ECHO are doctors, nurses, behavioral health clinicians, managers, administrators. You see a lot of stakeholders come together to bring this ECHO hub to life and bring specialized care no matter how far or no matter what limited resources are in the area. In ASU ECHO in particular, they specialize in behavioral health integration. I'm going to talk a little bit about that as we continue. So what makes ECHO really strong is, and brings a lot of participants from different backgrounds, is the CME credits, which is continued medical education for physicians. For participating in ECHO, they get credit for continuing knowledge and continuing their education, as well as it allows providers with to deal with complex cases in a high quality manner. And it can reduce medical errors as well as overall costs and improve health outcomes for patients. This is really cool because even in places like rural Arizona, where there's a high demand for physicians and there's limited resources, ECHO could help bridge that gap in the sense of bringing knowledge, bringing information that might not be readily available through technology like Zoom and other web conferencing technology. So as great as it is, there are some limitations to it in regards to funding. One of the biggest limitations to ECHO is that there needs to be more funding and support for this type of programs, and as well as maybe scheduling and technological issues. These healthcare providers are in demand, either have high clinical demands or busy schedules, so it's hard to figure out a time in which they are available. So, and as well as limited bandwidth in different locations too. Just like right now, our Wi-Fi is great. I could see you all clearly, you could see me clearly, but that may not be the case for everyone else that participates in ECHO hubs. And in regards to funding for the New Mexico, which is like the model Echo Hub, they were able to pass a health policy where they can get funding from the government to continue this program and protect the times of the people that participate in ECHO. So ASU ECHO in particular, like I mentioned, it's a behavioral health integration model. And in this model, it's like holistic care. It's including the mind and the physical health of a individual, as well as there's been studies to show that patient behavior also impacts health outcomes. And in this model also, you can destigmatize mental health, because when a patient, for example, goes to their primary care doctor who already integrates behavioral health, they may not know that they're being checked for a mental health disorder and things of that sort. And a good example that I like to share with why behavioral health is important is that 10 of the most the top 10 causes of morbidity and mortality rates in the US have modifiable behavioral factors. And the key on is modifiable behavioral factors. So if we could key on changing behaviors, it could lead to better prevention outcomes and better management and treatment of disease. As well as another great example in research found that people with diabetes are 2 times likely to have depression. So if you have a patient with diabetes, and if they're suffering with depression and you're just healing or you're just trying to cure the disease itself and not looking at the other outcomes that may result in a trickle-down effect in their health outcomes, then you're not really holistically healing or creating better outcomes. So for my study in particular, in regards to ECHO, over the years, ASU ECHO participants have been declining. And I came into this team kind of trying to figure out, like, what are the barriers to participation in ASU ECHO and what are the facilitators to these barriers? So I coming in to identify what can we do moving forward to increase participation and to help bring more people into this ECHO model learning and this environment, which in this time you see how important telemedicine is, especially given the crisis that we're in right now. So to do this, my survey design was 3 simple questions, or 3 questions that could help answer different assumptions that we have. We were hypothesizing because of clinical demands and high scheduling that these people may not have time to do a survey. So why don't we make the survey as quick as possible and efficient while we're able to gauge our key questions, which are what are the barriers and what are the facilitators? What we did then was send the survey to 27 ECHO participants, and we sent it twice. The first time to let them know, like, hey, we're doing this survey, we need your help to improve our ECHO hub, and the second time was to remind them to participate in this learning hub or in this survey. So I want to share an example of how the questions were set up. So participants were able to check all that applied for them. And as you could see on your slides or your cell phone or your computer, that we asked different things in regards to scheduling, maybe not able to access Zoom links, or they don't know the topics that are going to be discussed. And as you see, it's versatile to kind of gauge a different understanding of what are the needs of these ECHO participants, as well as if what we said is not listed, they have the option to also include another barrier for them. And the same thing of the facilitators question looked the same way as well. And the first question is understanding what role do they play at ECHO? What are they, a clinician? Are they a manager, a behavioral health consultant, and so on. So the results are as follows. We got our 30% response rate for the survey, and we found that the biggest barrier for participants is that their time or schedule does not permit. So that kind of proved our assumption, as well as having high clinical demands, and everything else kind of varies on this chart. But the facilitators to this are that participants would like calendar invites like on Outlook or Google Calendar, as well as regular email reminders. And more, the one that surprised me personally was that they wanted a more detailed information about their roles, their expectations about being an ECHO participant. So looking at this data and seeing these results, I came up with kind of recommendations that could help improve ECHO participants' experience in the telemedicine hub. So the first suggestion is to have a administrative staff to help manage the schedule and negate artificial variability. So artificial variability is anything that you can control, like scheduling, time slots, being a time that works out for everybody, and non-artificial variabilities are things that are out of your control, some things that happen in an emergency situation, and so on. Also, knowing that a lot of participants did not really understand their role or their clear expectations, having that written and branded on ECHO website, on Project ECHO, ASU's website, is helpful, because I looked from my experience, I had a hard time navigating that on the website. So having it clear and out there is really important, as well as simply frequent reminders. And that kind of goes under the administrative staff role to help negate that issue. And something in regards to reminding participants about their role, these are bi-weekly meetings that ECHO has. So maybe just reminding, setting the tone, setting the ground, like, hey, these are the roles and these are the expectations, just really briefly. And of course, having an informational guide about ASU ECHO, the mission, the roles of participants, and other key information that could make the process a lot smoother. I'm trying to remember if there was any other recommendation. Okay, and also about the mission. So the reason why I'm honing in on the mission being an important thing for ECHO to brand is that physicians that have, there's a research study on physicians who understand the mission and goal of their hospital, enjoy it more, and even stay longer too. So that concludes my research study, and the further steps and conclusion. The further steps I believe for the study are to understand what are ways that we could support providers to reach their fullest potentials, especially in those rural and underserved populations. And another question is, like, what are the common integrated health problems or complex problems do providers face on a day-to-day basis? With that, I'm going to open the floor to any questions and comments.
Thank you, Tabark. I'll start with the first question, if that's okay.
Yeah.
So I know that you have a keen interest in public health, and that is part of your career path that you are on. From your experience now with ECHO, what are some of the benefits that you think ECHO can have for public health initiatives out there, whether it's in the US or other countries?
Mm-hmm. I think that's kind of what drew me into ECHO, because I was thinking a model like this would be really cool to have in Sudan to help knowledge share. So in regards to public health, I think ECHO can bridge a lot of those gaps of knowledge and missing information and provide care or give each person an equal opportunity to receive health care. Like Dr. Aurora's quote, like, really inspired me, like, no one should be dying because of curable diseases, and everyone should have an equal opportunity to health care. So I think ECHO does a good job of facilitating that, and in a way that is accessible to physicians and other primary care health providers.
Great, thank you. We can open it up to other questions, and once the questions are done, Dr. Manson and I can go into the group meeting and discuss our decision.
Okay.
I kind of have a twofold or threefold question for you. Can you hear me okay?
Yeah, I can hear you well.
Great. So I want you to take a moment just to consider the process of what you developed with this, okay? And the results that you had, and the results gave you some recommendations, right, for improvements. And those improvements, if you want to consider that for a moment, I want you to think about that and think about your future and how to apply those types of improvements and this type of kind of the functioning of this project within the healthcare industry. So I'd like to know, when you think about all that together, it's a lot to hold for a second, okay? I want you to think about that for a second, and I'd like to hear from you about how you might design or add or recommend specific things to the healthcare industry when they start to consider new projects or reviewing their own progress, looking at quality improvement. Are there specific things that from these recommendations perhaps that you've identified, perhaps from the research, perhaps from just your experience, that you might say, I think these types of things at a consistent basis should be discussed and reviewed when you're looking at new ideas or looking at old projects or reviewing for improvement? Anything that comes to mind?
Yeah, I think what this goes to show that healthcare is not exclusive of just clinicians. You need a team to kind of come together to provide the most adequate healthcare possible. So you need the people that have the management skills, the leadership skills, the technical skills to help see these programs. You could have a vision, but if there's no way of executing it, then your idea will not be possible. And I think with reflecting on New Mexico and how they kind of become the hub for ECHO, the model hub, they integrated different sectors to provide a successful ECHO model, meaning that they had people in health policy backgrounds. They had the clinician who was first inspired by the idea and believed that everyone deserves adequate care. They also had the managers, and it's just really beautiful to see all these different career paths intersect with one another, and kind of inspires me in the way with my own career path. Like, I am a pre-med student, but I'm also doing public policy or health policy in specific. So for the longest time, I almost believed that, hey, it's not like, is this weird? Am I doing what I'm doing right now? Is this wrong? I was questioning myself within these past couple of years. But seeing this ECHO model and what the infrastructure that they've created, bringing different talents and different skill sets together, shows that you can even have a better and beautiful outcome with diverse interdisciplinaries. And on a personal level, I also saw that time management is very important no matter what career, what field anyone goes to.
Right. And yeah, and that's part of everything too. And I want to point out those three things that I heard you say and touch on in that, is that one of it's a team, and there's many members of the team, and we always have to look at that team as interdisciplinary, including the patient, you know, if we're thinking about healthcare. But in all situations, it's got to be every member there. But it's also about the engagement, right? About how you're reaching out, how you're bringing them all, and how you're focusing them. And one of the things that you really pressed is that mission piece. And that mission is critical. It is essential that everyone understands that. And in healthcare, sometimes we all don't. Sometimes we could be working on a team, but be completely siloed. And that's what's so important about bringing that focus back for everybody, so that we can have that motivation and that drive and really be able to feel and work as a team. Those things are wonderful. I'm really glad that you emphasize that. So thank you. I'll open it up before I ask any other questions for someone else.
Any other questions for Tabark? You can unmute yourself. You can also submit questions through the Zoom chat, which is at the bottom of the window.
Hi, Tabark. Can you hear me?
Yeah, I can.
This is Jerry Oliver. Of course, this is not my forte, this discussion, but first of all, I want to say that I'm impressed with the with the presentation and the defense of your thesis. I have a question, probably more of a lay question about mental health in rural areas. And if ECHO has a dimension that deals with rural mental health situations where resources are limited, and that there are better outcomes for people in remote areas.
Sorry, could you reiterate the question one more time? I lost you near the end. Sorry, Dr. Oliver.
Oh, you didn't hear my question. I'm sorry.
Yeah, it disconnected.
Okay, in a nutshell, I'm asking about mental health in rural areas, which is really surfaced lately with the COVID-19 and some of the and the Navajo Nation, and not so much about mental health, but just in terms of services. And so I'm wondering if ECHO, in the way in which you described it, will help with better outcomes for mental health, and you had mentioned that earlier in your presentation, for people who are in remote areas. Is there, when we're talking about this, having a team approach?
Yeah, I think it definitely has the potential to help out in these areas in particular, because a lot of the physicians that ECHO participate, or the clinical or the providers that ECHO participates with, are in these rural areas, and they are dealing with patients that are coming from an indigenous background. So when you integrate mental health with physical health or that type of care, you don't necessarily give the patient the perspective like, hey, I'm about to see a therapist right now. It kind of happens like simultaneously, where within their diagnosis, they ask questions like assessing how they're doing. So it could help out with mental health issues with treating specific diseases. And I'm also going to pass the question to our experts with ECHO here, Dr. Martin and Dr. Manson, if you want to add anything.
Sure, I can chime in. So Dr. Manson is actually leading an ECHO group right now that actually, I believe, just met yesterday, Dr. Manson. And this group is actively working to adapt behavioral health services in the face of COVID-19. And so she's working with clinics all across the country. Some of them are in urban areas as well as rural. Some of them have patients that are having a really hard time accessing their behavioral health providers. And so since we are under lockdown in a lot of parts of the country, we're trying to figure out creative ways to still reach these patients, whether it's through phone calls, video calls. And so a lot of clinics are trying to figure this out on the fly. And so this ECHO Hub that Dr. Manson is leading is helping to generate and share some of those ideas.
We've had,
Right.
yeah, we've had a number of sites across the U.S. join. On average, we have about 125 join each time. We've had up to 300 and something join during one Project ECHO time. And so we do have a number of participants. One thing to point out is most Native tribes throughout the United States already have their own Project ECHOs. So they work within their own culture, their own projects that they're working on. So Indian Country Programs has their own Project ECHOs. Alaska Native has their own Project ECHOs. Hennepin Healthcare throughout the Midwest area, they have their own Project ECHOs. And then there's a few others that do throughout California, and they also focus on specific things like substance use, et cetera. And they're already very active in that. However, as much as we can all be very active and very visible about, there are all many tribes that do not have access, and that purely is because perhaps the lack of knowledge of it. So it still needs to grow in knowledge and popularity and have that outreach. So hopefully it will over time. And the more and more we can talk about it, the more and more we can link out to folks and bring them in, because participation's free always. And that's what's wonderful about Project ECHO. So.
Great, thank you.
I did have one other question. I'm going to put it right there in the chat box for you as well. But it's basically, you talked a little bit about how you're starting to envision yourself again in this role in that future as a medical provider of some kind, right? And I want you to think about that. And have you started envisioning yourself in that future role and doing projects like this? And if so, have you had any just ideas? You know, right? Those are the things that help us to get our passion going, to keep our motivation going. Because this path will have many challenges. So we want to hold on to that. So I'm asking you, what have you thought of? What have you experienced or had thus far?
So the question is, I don't know if people have access to the chat box, but I'll read it. Have you developed a vision of yourself as a practitioner? Do you envision something more specific? I think I'm most passionate about preventive care, preventing the disease and curing it before it gets worse. So I see myself kind of either in primary care, actually. So ECHO just kind of like fits in what I want to do. Looking at a patient more holistically rather than just a quick process of like, what are your symptoms? Okay, here's a prescription. Okay, bye. I want to understand like what are the challenges that you face? What habits are in your everyday life that impact your health? Like the social determinants of health, like people's zip codes may limit them to accessing grocery stores, and that might cause an effect in whether on like diseases like cholesterol or high cholesterol or diabetes, and all these things I think matter in health, and it's important to kind of look at the two.
I'm hearing you develop into not only the traditional right medicine, but also behavioral medicine. We've had an impact. That's awesome. I love it. That's a great answer. It looks like you've got some more questions to answer.
Yeah. So this question is from Noonie. Thank you so much. How do you see ECHO contributing to mental health and even COVID-19 in places like Sudan where access is limited? I think Sudan was the first thing that came into my mind when I first heard about ECHO. How knowledge sharing information like on a global scale could help connect physicians in Sudan with different resources that could be available, or different treatments that might be available in Sudan. But in regards to mental health in specific, if I'm going to describe it like just like in layman terms, like you don't know that you're being, like with behavioral health integration, you don't necessarily know that you're being treated by a behavioral health therapist or someone with a psychology or psychiatry background. So given that how stigmatized it is in Sudan and in the US too, it could help normalize mental health and normalize seeking treatment to mental health. I hope that answers your question, Noonie. Zarella, thank you so much for also asking a question. Your question is there a way that legislators can help aid with these type of projects? Is there a way that a more privileged public can do? Wow, that was a tongue twister. Okay, so yes, definitely. I think in the New Mexico example, seeing that how they got legislators in the process to pass a bill to basically get the New Mexico government to fund this project and help it grow was one way that I could see legislators providing aid and help. And also it shows when a policy is passed or when legislators take a public decision or advocate for something like this, it shows that it's important, that it's needed, and could help potentially encourage programs like this to proceed. And is there a way for people with more opportunities to help out? I think that's the question. And I think yes. I don't know if ECHO currently has donation opportunities, but I know that ECHO does do a lot of grants, and it's a grant funded program. So funding those grants really helps the program continue. Is there any other questions? Right, thank you everybody for the questions. I was really nervous for this part. I was like, am I just gonna awkwardly stare at the screen? So I appreciate all the questions.
Those were great questions. Tabark, are you ready for Dr. Manson and I to meet?
Yeah. Oh wait. Yes, I think those are all the questions. I am ready. I'm gonna stop sharing my screen and send you both to a breakout room. The moment of truth, family and friends.
Back, I hope you were able to get your mom on to hear this. This is good.
I think me. She's on here.
Your mom is always on here.
Yeah, I hear you.
So proud. I'm so proud on you, Habibti.
Thank you.
So proud.
إن شاء الله دائما نرفعكم وتكونوا فرحانين بنا.
آمين. ربنا يوفقكم وينجحكم ويحفظكم يا رب.
آمين يا رب. Thank you, Miti. You are the reason I'm the way that I am, I guess. And you've been through so much and you've overcome so much, and your resilience is what inspires me to keep going. So shukran.
إن شاء الله ديما رافعين راسي، وإن شاء الله ديما موفقين وناجحين. وما قدروا قدرتكم يا رب. ربنا يديكم العافية.
آمين يا رب. I'm about to cry, guys.
Wow.
So we're happy to announce that you have successfully passed your defense, Tabark, and we'd like to congratulate you.
Thank you. I don't even know where to begin in saying thank you and like who to begin saying thank you to, but you both made this experience like remarkable. When I was reflecting on just doing this thesis, and I know there's some soon-to-be freshmen, don't feel overwhelmed. Don't ever feel like you can't do it or it's not possible. I felt like that way, and here I am. I missed every deadline that Barrett had. So believe in yourself, believe in that you will push through, and also look for the people that believe in you too. Like this goes to Dr. Martin. I came in like it was already summer at this time. Barrett students already like have their projects figured out, know what they're working on. And I'm like, hey, can I work on ECHO? And you took me in an open arms, and I'm really appreciative of that. And Dr. Manson, like I love your thought process, how you think, how I think you even challenged the way that I think too, and that has been such a remarkable learning experience. And to everyone that I hit up last minute to join this Zoom defense, at first I wasn't super excited. I was like, you know what, it is what it is. But you all jumped through. There's been like 24 people on this, and this is amazing. I'm so honored to be graduating in the class of 2020, and I don't think it could get better than this. And like my brother, Hamad, you also inspire me too, and how you made it through medical school, how you pushed through a lot, and you always continue to inspire me, and with your hard work, with your diligence, and always like seeing my potential too when I don't see it. And I know if Abuna or if our dad was here today, he'd be really proud of all of us. So thank you. And thank you to all my friends. I don't know what else to say. I just need to reflect on this moment. This has been amazing.
Well, congratulations. You deserve all of the wonderful comments. The chat line is just exploding with congratulations. I wish there was a way we could save that for you so you could read it later. So at this point, you can relax and know that you've done everything you needed to do for this thesis and for this presentation and defense. And so please keep in touch with both me and Dr. Manson. We are very excited to see where you end up over the next few years.
Definitely. Yeah. Want to hear if you're going to be, at like local colleges for med school or something else, for a period of time in between. What are you thinking? What leadership you have and where you're, directed. So definitely keep in touch.
I will. Definitely. Thank you.
I want to just say one other thing. Sorry if I'm talking way too much. I'll stop right now after this. But when I, it was probably about 10 years ago, one of my kind of leaders for me was someone at my healthcare sites, and I was a director at that time, and I was becoming an executive officer of my healthcare sites. And this director there, who I always looked up to, stopped me for a moment and said, there's one thing about having the intelligence and having the skills that, people have or that I may have, but it's another to be able to see inspiration and motivate others and inspire others. And that's truly what leadership is. It's not about those other skills that you can have. It's about that recognition that you can see it in others and that they can see that in you and be inspired by you and be motivated, and that you can recognize that too. And that was really important for me. And we talked a lot about how in everything that you do, and when you start to become that professional and that leader, to stop for a moment and think, how am I doing this task? How am I doing this so that I can do this with my values intact? I can do this by leading by that example, that I can say that no matter what the choice I made or how I said it, that I can go back and either correct it because it wasn't in my value, or that I can stand up to it because I recognize it is. And that's how you want to inspire and lead and motivate. And so I just want to say that because it's always been something that has stuck with me that I need to always remember. And so I always try to talk to people, I see you in that, and I see your ability to move in those directions. So always remind yourself of that, of who you are, of who inspires you, and about how you are an inspiration. So you can hold it, but always align it with that mission, with your own values is your mission. So that with every decision you make, even if you make it and it's outside of that, right? You're late to the party, you miss your deadlines. That might conflict with your values sometimes, but that's okay if you come back and you always acknowledge it, because that's what true inspiration and motivation is about, right? So congratulations, it's great. So thank you. That's all.
Thank you.
I finished my thesis defense. I'm done. That was remarkable. Pretty much almost cried. Everyone was so inspiring, and that was phenomenal. I was inspired by how many people joined. I was inspired by the words that my directors had to say. I was shocked, I guess. But that was great. That was great. I'm happy to be done, and now on to finals.